Pediatricians and accountants can save the American dream. Some of you look skeptical. You might be thinking pediatricians excel at things like cooing over babies, or talking about potty training, or even taking care of really sick kids. Or you might be thinking accountants are kind of boring math nerds who tell you depressing news about how much money you owe the IRS. But I want to paint you a different picture, one in which pediatricians can talk about money and accountants can be superheroes. Any of you that went to accounting school, that might not have seemed possible, but wouldn't it be cool? If these two groups collaborate, they can help families move ahead economically and have better, healthier futures. Let's take a step back. Who says the American dream, the dream that all families who work hard can get ahead economically, even needs saving? In July, the White House announced that the war on poverty, first launched in 1964 by President Johnson, is over. And in May, the Labor Department announced that we'd hit the lowest unemployment rate, 3.8%, since 2000. These economic reports do not match my patients' realities. I'm a pediatrician at Boston Medical Center, which is New England's largest catchment hospital. 85% of my patients are in Medicaid. Most are minorities. 40% are immigrants. So just the other night, a mom broke down in tears when I asked her how things were going. She told me how the family became homeless after their ceiling in their rodent-infested apartment collapsed and the landlord refused to return the deposit. She then was fired from her job in the fast food industry because she had to take a couple days off to ensure her kids had a safe place to sleep. She told me she felt like a failure as a mother, even though her children were really delightful and clearly deeply loved. I really wish I could tell you that story is an anomaly, one that I carefully selected to make a point, but it is not. Most days, most of my families are economically struggling despite working. To really fix some of these problems, we need better social policy. But we do have many underutilized resources to help families now. And the biggest of these is a tax credit. The Earned Income Tax Credit, or EITC, is the largest anti-poverty program in America. Families who have worked at all can get up to $6,000 from it. It is not only good for low-income families, it is also good for the economy. Single moms who receive this credit are more likely to keep working. The EITC can be worth up to a 30% raise. So the economic benefits of it are really multiplicative. And just like we know poverty is bad for the economy, $500 billion a year is lost because of it, and bad for health. Poor children in the United States have differences in their brain development, are more likely to be hospitalized, and are more likely to die. The Earned Income Tax Credit is also really good for health. So receiving the Earned Income Tax Credit is associated with decreased maternal depression and smoking, improved infant birth weight and development, decreased infant abusive head trauma, improved school performance, and increased future earnings. But the problem is 20% of families who could receive this credit do not. They don't file taxes or they don't claim the credit. And 60% of those who do receive the credit pay a preparer, losing up to $400 of their refund. Free tax preparation services are available through an IRS program called VITA, but only 1% of families who are EITC eligible use VITA. 1%. There are many reasons people don't use VITA, including they don't know about it, they have trouble getting there, or they don't trust it. So one solution to this problem is integrating free tax preparation into doctors' offices. A frequented, convenient, trusted location. In fact, it's the only location that young children under 5 systematically visit. So, that is exactly what Dr. Michael Hull and I did in 2016 when we launched Street Cred at Boston Medical Center. We have since expanded to 9 clinics and hospitals in 4 states. We've helped 1,700 families claim over $3.3 million. So we're happy with this start, but we know we could do more. Economic mobility is really about more than taxes and employment. So one example is that encouraging parents to work more hours, like the EITC does, without ensuring they have access to safe, affordable childcare and can spend quality time with their children isn't realistic, and it honestly isn't really good for child development. So I worked 80-hour weeks as a resident and had irregular hours, no control over my schedule. I can tell you that really wasn't humane, and I certainly would have struggled to raise a child while doing it. So the next step in this vision is to create a hub at doctors' offices, meeting families where they're at to really exponentiate economic mobility. And part of that solution is probably using tax data to streamline enrollment in other services, things like Head Start, food stamps, and health insurance. But an equally important component is thinking harder about using public-private partnerships to create new models of care. We are in discussion with EY about seeing if we can create a relationship to give our moms access to their financial planning apps. How powerful would that be? Boston Medical Center's Center for the Urban Child and Healthy Family is working with a nonprofit Empath to integrate their evidence-based financial mobility methods into routine clinical care. We may be able to use an app called Health Rhythms, which uses routine phone utilization data to identify and then manage mood disorders to help our families, because we know mental health impacts everything from parenting to employment. So these few examples I just gave you span 3 worlds: accounting, nonprofits, startups. If we can bring together these diverse teams and deal with surmountable challenges like data sharing and protection, we can use public-private partnerships in the trusted setting of the doctor's office to create a new system for economic mobility in the United States. So I would be remiss if I didn't point out the obvious, which is that I am a white woman with privilege. And most of the families that I am trying to serve are not white, and they are decidedly not privileged. So my privilege gives me a lot of power, but I don't have all the answers. I can't viscerally understand what my family's lives are like. And that's why we need not only doctors and accountants, but also families and community organizers working alongside us. That's why we have a community advisory board at Street Cred. Every mom I meet tells me something new. They know what they need, what they want, what they hope for, and what challenges are making those dreams distant. So all we have to do is listen and then work together to make it happen. We can change the course of our country. We can recapture that lost $500 billion and save the American dream. But we can only do it if we all work together and only if we meet families where they're at. Thank you.